Good afternoon, friends of the Granbury Chamber. This is Maureen Griffin, and I am here with Dr. David Blocker. He is our Hood County Public Health Authority, and he's going to answer a couple questions about coronavirus for businesses, what they should be concerned about, and give us resources for the correct, up-to-date information. Dr. Blocker, thank you for joining us.
Maureen, I appreciate the opportunity. Thank you very much.
So, first out of the block, would you like to explain what you do as our Hood County Public Health Authority?
Sure, happy to help with that. I am a doctor, recently retired out of the Air Force and merged in here in Granbury. I grew up in Fort Worth area, and part of my military training for the last 21 years was being involved as a preventive medicine and aerospace medicine specialist, which included some additional training and representation in, again, preventive health, public health, and working with different communities around the U.S. and around the globe to make sure populations stayed healthy and active, and were able to again, do the work that they needed to do, participate in the community the way they needed to. So as your local health authority here for Hood County, my role is in coordination with our county officials and with Texas Department of State Health Services and other agencies that do provide formal resources in terms of public health for our community. Here in Hood County, I am an appointed volunteer to support, again, the judge in the county. I work hand in hand with our local Texas State Health Department resources, one nurse and one assistant that work here and cover 5 counties. And then we work very closely with the regional offices in Arlington, with Tarrant County is the closest actual health department, and then our other agencies that involved in things like emergency management, medical support, and things like that around the community. And so when it comes to things like the coronavirus or influenza or any other emerging infectious disease, it really is a collaborative effort between your appointed officials, your experts in support of various areas like myself, and the different businesses and agencies that work, live and work here in the community to all come together and make sure we all stay healthy and safe.
Fantastic. Thank you. Well, I know that you are busy, so we thank you for taking the time to speak with us. We've had a lot of calls, well, not a lot, but several calls at the chamber asking us from businesses, what should businesses in Hood County be doing now to prepare for, or prevent the coronavirus in their workplace? Can you give us some advice, please?
Sure, I appreciate that. I think it's most important to initially put this in context. Coronavirus, specifically this novel coronavirus that started off in China, and has gotten a lot of attention in the media and the press, a lot of attention around the U.S. and around the globe, and that's understandable as an emerging infectious disease. However, I think it's important to put it in the context of disease that's already here in the community. For instance, we're at the tail end of the annual flu season. And every year you hear from various doctors' offices, hospitals, community leaders, school officials, and you need to get your flu shot, you need to get your immunizations, and protect what you can protect against, because we know that in the season right now we still have 6 to 10% of the cases with flu-like illness that come and present for healthcare needs at any given day, whether it's a doctor's office, emergency room, what have you. And some of those are very severe. As a matter of fact, here in our region, which not only includes Hood County, but includes all of Dallas-Fort Worth, we've had over 800 deaths from influenza this year, from September, October of last year through the first part of this year. So again, influenza is a very real concern. And the interesting thing about it to me is, the same way you prevent coronavirus or deal with coronavirus is the same way you deal with influenza or all the other common viral and bacterial diseases that go around, especially in the time of year when it's colder. You protect yourself. You do good hand washing technique. You don't sneeze on other people. You use a sleeve or something else rather than spreading germs into the atmosphere around you. And you don't hang around with anybody else who is doing those kinds of things, right? You help encourage that healthy behavior. And then you limit exposure to public places or coworkers or what have you, with what we call social distancing or self isolation. If you are sick personally, don't go to work. If your kids are sick, don't send them to school to get others sick or what have you. And those are very simple concepts. And those are outlined, and we've heard them all from a school nurse or a coworker or what have you. But I think it's really important to put that in context, because protecting from coronavirus is just the same as protecting from flu or any other illness like that. And then the other really important thing is hand washing and cleaning surfaces. Coronavirus specifically doesn't require anything different than an alcohol-based hand sanitizer or soap and water to clean up your hands, clean up surfaces around a workplace. It frustrates me so often when I see people go to the restroom and they either don't wash their hands, or they wash their hands and they're touching the taps that they just touched with dirty hands, and then go and opening the door, the same door opening and closing that they again had dirty hands used on against. So it's common sense, but sometimes it's good to have that reminder that protecting against coronavirus is just the same basic things as far as personal protection, and then community protection. So I know you have a few more questions. I'll let you go on to the next question.
Thank you. So what should a business do if an employee feels sick or thinks that I might have been exposed to coronavirus? What would you advise an employer?
Okay, great. The CDC, Centers for Disease Control in Atlanta, has a great set of guidelines for businesses, and I know y'all shared those on this same Facebook page within the last couple of days. And I go back to that, the CDC guidelines and then the Texas Department of State Health guidelines, that, by the way, are all available from those web pages. I think you'll be able to list those, but it's if you just Google search for CDC coronavirus or Texas DSHS, Department of State Health Services coronavirus, you'll have a whole list of handouts and resources and information, and most of those are just a page or so long to get right to the point. So when it comes to workplace relations, again, if someone's sick, don't require them to have a doctor's note, because unless someone is sick enough to need specific medical care, to need a doctor's evaluation, a lot of times we can gum up the doctor's office with a lot of people who don't really need to be there, and then you're just sharing your basic cold and flu viruses and things back and forth with one another, or being exposed to those unnecessarily. If someone is ill and has symptoms of cold or flu, it's best for them not to be in a physical workplace, or children not to be at school until they're fever-free and they're not actively, coughing or again spreading those germs, spreading those viruses. So schools have those policies. I would recommend any workplace should look at their policies very closely. And one thing that's hard for me, Maureen, as a doctor, all too often, I've got to go to work because the patients are going to come see me in the clinic. Well, as a healthcare worker, as a doctor, I'm more likely to be exposed than your average Joe in the workplace, because I'm going to where sick people are and they're coming to me. But the same thing applies to me as a healthcare worker. I've had good nurses and good staff in my clinics before send me home. It's not good enough that I put a mask on so I don't cough on people. If I'm coughing, I'm actively sick, I'm not doing anybody any good by being in the workplace. I'm not going to be productive, and I'm just going to increase risk to others. So I encourage you guys to do the same thing. Don't go to work and support those practices if you're an employer, in order to balance those things out. Use telework, use other opportunities. Use all these apps that are on our smartphones or computers or what have you to find other ways to get business done without people being at work if they're sick.
Well, you kind of mentioned my next question here about we're hearing about an infectious disease outbreak response plan, and you mentioned where can they go again if they want to help put that together? Okay, great.
Yes. So the Centers for Disease Control website has a specific link under the coronavirus link for advice for businesses and employers, and that also has links to OSHA, Occupational Safety and Health Administration guidelines along the same lines. And again, it's not just coronavirus. That's what I want to stress. It's response to infectious disease. So it's influenza, it's coronavirus, it's other diseases that might be highly transmissible, easy to share with others. Having a preparation, having a guide, because again, it's not just the workers, it's the families, right? If your kids can't go to school, well, the workers aren't going to make it to work either, unless you have a bring your kids to work policy. And again, if the kids are sick, they shouldn't be at work with you, making others sick or any more than they should be at school. So those things just make sense. Look at the basic standard guidelines as far as leveraging technology, enforcing social distancing. Don't bring people in large groups together unless you absolutely need to, because you recognize that in the middle of cold and flu season, in the middle of any type of a viral illness or what have you, that's just going to increase the risk of transmission. be smart, use other ways to get the work done. If you're in a business where you absolutely have to have people in place to get the work done, then use the healthy ones, keep the other ones at home. And again, at the end of the day, it's going to help your business, and it's going to build trust and respect for your business as well, that you're not putting people at risk. Let's face it, if I'm going to one of these restaurants on the square, I don't want people serving me wearing masks because they're coughing into masks. They shouldn't be there at all. But that's another thing, Maureen. This is kind of a sidebar. I don't know if this is the question, but people talk a lot of times about masks and things like that. People shouldn't routinely need to wear any kind of a mask to protect themselves from the people around them. The only people wearing masks should be ones that are actively coughing and can't control it and are trying to, they don't need a doctor's visit or something. So again, people walking around the mall, people walking around this Granbury Square here, if folks are wearing masks, it's either out of a misplaced sense of protection, or a misplaced sense of, hey, I've got to be out when I'm coughing and I'm sick. Again, you really need to find other ways.
Any last words of advice for us?
I don't think so. I would just encourage people to to look at the facts, get factual information. Work with us. Again, I appreciate the Chamber of Commerce having taken the opportunity to share some of these facts and some of this information. I work on behalf of our county officials, work with Lake Granbury Medical Center, work with Texas EMS, work with our surrounding counties in the region to make sure we're all on the same page when it comes to protecting ourselves, one another, from things like coronavirus, influenza, and other things. And at the end of the day, it's my family too. I'm here supporting my family, my community, and we all benefit from it. Thank you for the opportunity, Maureen.
Thank you so much, Dr. Blocker.